move on to sort of some introductions. The first thing I want to just state that, we've been working with honestly with a number of individuals over at North Carolina Medicaid and DHHS in preparation for tonight. We've been doing this work since around mid-December and gearing up to bring not only the information you'll be hearing this evening, but some additional resources that will be made available to pharmacists after this evening's webinar. But our speakers this evening, I want to extend a welcome to Angela Smith. Many of you already know Angela. Angela serves as the pharmacy director, the director of pharmacy within North Carolina Medicaid, and she obviously manages a lot of things other than pharmacy. But this evening, she's coming to us in her role as director of pharmacy and sharing some information that's very exciting in this new era of pharmacists being recognized as providers. We're also trying to get Charlene Sampson connected. Charlene is the individual that we've been working with very closely over the last 4 to 5 weeks in preparing for this evening. And Charlene serves as a pharmacist consultant within the Division of Health Benefits and Outpatient Pharmacy. And so we're very pleased to have both Angela and Charlene joining us this evening to present content. Also presenting this evening is my colleague, Cheryl Viracola. Many of you know Cheryl. Cheryl serves as a director of practice advancement here at NCAP. And we're all going to be pleased tonight to be able to work together to present information and also answer questions that you may have. One acknowledgement that I want to make this evening is I want to give a shout out to Elizabeth Locklear. Elizabeth Locklear serves on the board of directors for NCAP, but she is also a pharmacy owner. And Elizabeth has been working very closely with Cheryl in providing many of the screenshots because she's been going through the enrollment process and claim submission process. And we have a number of screenshots that we're going to be sharing this evening. And much of that has been made possible by working with Elizabeth through this process and getting sort of that early adoption experience and sharing some of the things that we're learning as we're going through this new authority to have pharmacists enrolled as providers with Medicaid. So I'm going to move on. And want to just say that what we're going to be covering this evening, honestly, what we want to do is share some general background. We want to sort of paint a picture of what's led up to this historical moment. The other thing that we want to do is share some information with you regarding all kinds of information around requirements, navigating the enrollment process, information about taxonomy and codes that'll be used in claim submission. And a lot of that detailed information some of that will be provided tonight, but we'll also have resources that'll have even more details available to you after the webinar. We also want to share, sort of the stepwise sort of process of submitting a claim for contraceptive care, because this is the first service that Medicaid is going to be recognizing for payment for pharmacists that are enrolled as providers within North Carolina Medicaid. And then, of course, we're going to be sharing some information about those helpful resources that I've already mentioned. And we'll be showing you how to get access to those. So let's get started first with background. And I want to just paint a little bit of a picture. I want to take you back in time regarding, go back to 2021. I know many of us were thinking and in the midst of throes of the pandemic, but what I want to do is point back to in 2021, the state association was working with a number of legislators and getting a bill passed that eventually did pass and was signed into state law as 2021-110 that granted immunizing pharmacists the authority to provide hormonal contraceptive care, tobacco cessation care, and also HIV post-exposure prophylaxis care. And I mentioned those three because those three have assessments that are involved in the provision of the care. It's not just the dispensing of the medication, but there's a process of assessing patients and providing care wrapped around the actual medication that may be dispensed. So there were a couple of other items that will be mentioned in passing that also were part of that state law. But these three are important because these are services that we envision in the future, that there will be this ability to be paid for the care in addition to being paid for the medication. One of the things that I want to mention around this too is that initially that law was written to where it was to be enacted using a statewide standing order. And that was done to provide time for the boards of pharmacy and medicine to be able to reach an agreement around enacting it through a statewide protocol. And it is this transition from a standing order where there's a physician, and in this case for North Carolina, it was the state health director, Dr. Tilson, who was the prescriber on that standing order, to a statewide protocol where the pharmacist will be the prescriber or on record of providing the medication for the patient. And Medicaid has done a workaround, and Angela may speak to that and when she presents her slides. So I'm not going to spend time on that. What I want to do is actually is speak a little bit about this graphic. Part of the reason that I want to share this is that this graphic is really showing states in general, not just North Carolina, but all states, how states grant prescribing authority to pharmacists. And regardless of which position along the way, with the exception of the far right, there is always either a protocol or some form of guidance that provides information around certain stipulations. There may be qualifiers. There may be explicit direction as to what has to be provided at the time of care. There's a number of ways that guidance documents and protocols can be wrapped around, whether it's collaborative practice, statewide standing orders, or statewide protocols. There's only one state in the nation that has any form of unrestricted category-specific autonomous prescribing to the far right, and that is the state of Idaho. So really, what's important about this graphic is as you move from left to right, we're moving more towards autonomous prescribing. And there is a caveat to that I'll circle back to regarding collaborative practice in a minute. But where I want to live right now on this slide is between statewide standing order and statewide protocol. And this is sort of a visualization of that change around State Law 2021-110 of how we have moved from a standing order that had Dr. Tilson's signature on it to the statewide protocol that is moving into more of that autonomous prescribing. And this is where the pharmacist's signature is now going to be the prescriber of record. Well, in doing so, it creates a whole new sort of challenge. And Angela's going to speak to that, like how we have like this change of the moving from the standing order to the statewide protocol creates new opportunity for sure, this is amazing. Like this era of having pharmacists having more statewide protocols, one, it increases access to care for patients, but the other thing that it's doing is it's helping to advance the profession. But there are some challenges that we have to navigate. And then that little caveat that I want to circle back to around collaborative practice, it's not that collaborative practice, the pharmacists that are working under those written agreements don't have prescribing authority. The reason on this particular graphic why collaborative practice is to the left, which is a little more restrictive, is that often collaborative practice is patient restricted. It is only the patients of a certain physician for which you have an agreement with, versus more on the autonomous end of the spectrum. We're talking about a patient being able to walk into your practice as a pharmacist and be able to have certain care provided under more of a statewide protocol, and it's more open to the care versus it being restricted to a certain patient population. So I'm going to stop there with my comments on background, and I'm going to now transition over to Angela. And Angela's going to bring that perspective of how this background and this change and this wonderful era of history for pharmacy is now beginning to move the needle a bit on how Medicaid is making some changes. So Angela, I'm going to turn the microphone over to you at this time.
Thank you, Penny. I need to let you know I'm having some trouble. It keeps kicking me out every few minutes. So I'm turning my video off. So I hope that's okay. And hopefully I will be able to stay in. My name is Angela Smith, and as Penny said in the beginning, I serve as the Director of Pharmacy and Ancillary Services for North Carolina Medicaid in the Division of Health Benefits. And the purpose of my part of the presentation tonight is to provide an update on North Carolina Medicaid's actions to improve access to contraception through pharmacists. As was mentioned earlier, Governor Cooper signed House Bill 96 into law on August the 20th of 2021, which authorized immunizing pharmacists to utilize statewide protocols to dispense, deliver, and administer several medications, including self-administered hormonal contraceptives, nicotine replacement therapy, prenatal vitamins, post-exposure prophylaxis for HIV, and glucagon. These protocols, they all started out as standing orders authored by the state health director, Dr. Tilson. Earlier this year, the standing orders transitioned to protocols, which were authored by the North Carolina Medical Board and the North Carolina Board of Pharmacy. And Dr. Tilson's name was no longer on the new protocols. This was an important transition for Medicaid because for Medicaid to pay for a medication, including those ordered off the protocols, the person responsible for selecting the medication per the protocol must be an enrolled provider within North Carolina Medicaid. Now, this presented an opportunity for Medicaid because until most recently, there was no pathway for immunizing pharmacists to enroll in Medicaid. This change to the protocols put the work we already had underway to enroll pharmacists on a fast track. Medicaid needed to ensure our members would have access to these medications, which are available from pharmacists, and we needed it like yesterday. Now, before I leave this slide, and if you can go back a slide, there you go. I want to point out that the list of protocols on the slide are actually hyperlinks to the actual protocols. These can be hard to locate, so we put the links in here for your convenience. Okay, next slide. So we are pleased to announce that effective this past January the 8th, Medicaid implemented 2 changes that support contraceptive access. First change is that immunizing pharmacists are allowed to enroll as providers in North Carolina Medicaid. And the second is that North Carolina Medicaid will reimburse pharmacies for utilizing the state protocols for contraception. This means that pharmacies will be reimbursed for not only the prescription that is dispensed, but also for the patient-focused work of assessing patient safety and risk factors and working with the patient on choosing the best option for them and providing contraception counseling. I'll go into a bit more details about these 2 actions. Go to the next slide, please. And the next slide. So the first change I want to talk about is immunizing pharmacists are now eligible to enroll as providers in North Carolina Medicaid. This is important because enrollment supports utilization of the statewide protocols, which authorize immunizing pharmacists to dispense, deliver, or administer any of the 5 statewide protocols, not just the one for contraception. For Medicaid to pay for drugs provided off these protocols, the provider must be enrolled. Enrollment as a Medicaid provider allows the individual immunizing pharmacist to be the prescriber on protocol claims submitted for Medicaid beneficiaries in the state of North Carolina. And ultimately, enrollment allows for increased access for Medicaid members to drugs prescribed off of these statewide protocols. Next slide, please. This slide lists out some of the details regarding the requirements of the pharmacist for an OPR light enrollment. OPR stands for ordering, prescribing, and referring, and this application process normally takes around 2 weeks for approval. The pharmacist must be licensed in North Carolina, and their license must indicate they are an immunizing pharmacist. They must have their own individual NPI number. The enrollment is for a level 2 taxonomy, and the cost of the application is $100. Next slide, please. Second, Medicaid will reimburse pharmacies not only for the prescription dispensed, but also the clinical services associated with the contraception counseling. As North Carolina pharmacists, you currently have the tools and legislative authority to assist people through the state protocols, which ultimately improves access for North Carolinians. This part is not new. However, utilization of the state protocol for contraception has been low, as these services require your time and expertise, and potentially requiring shifts in existing pharmacy workflows and staffing requirements. The lack of reimbursement for the time and resources required to provide these services has been cited as a barrier to uptake by pharmacists and pharmacies. Medicaid heard this and sought solutions that would enable pharmacists to provide this much needed service to Medicaid members, and that solution is reimbursement, not only for the actual medication, but for your time and expertise to utilize the state protocol. As more pharmacists use the state protocols, members ultimately have more points of access to care. So what does this mean for a Medicaid member? Members can walk into a participating pharmacy, request a prescription for birth control, and leave with as much as a 12-month supply of prescription birth control, all in the same visit with zero out-of-pocket cost. And as you all know, this is extremely important, as in many areas of North Carolina, especially rural North Carolina, the pharmacist is likely more accessible than a physician prescriber. At this point, I'll pass the baton over to Dr. Vera Cola, who will provide some very specific details regarding the requirements to enroll in North Carolina Medicaid as an immunizing pharmacist.
Hi, everybody. So yes, I want to just piggyback a little bit on some of the comments that Angela's already made as related to requirements for enrolling as a Medicaid provider. Of course, the first two I want to talk about is just this idea that you must be a licensed pharmacist registered with the North Carolina Board of Pharmacy. That probably accounts for everyone on the call tonight. But also this concept that you have to be a certified and trained, a confirmed pharmacist immunizer or vaccinator with the North Carolina Board of Pharmacy's database. Now, again, I want you to think of these as sort of setting the stage for you to complete your enrollment application, because if you haven't checked your status with the North Carolina Board of Pharmacy, you might want to do that. Just as, you know, a preliminary measure, you can go to the licensure gateway. We've provided the link there, and you want to make sure that vaccinator check mark is there under your licensing options. So you want to make sure that, again, you have been checked off as a vaccinator, and you are in the database confirmed with the North Carolina Board of Pharmacy. Again, Medicaid's going to check your licensure and your immunizing certification with the Board of Pharmacy records. So if you want to make sure that, you know, you want to ensure that these records are correct so that you don't create any delays or, you know, prevent hard stops in the application process. Next slide, please. Again, one of the other requirements that she talked about is that you must have this National Provider Identifier or NPI number. If you don't have an NPI number, then you need to go to the National Plan, I can't read that, I'm sorry, National Plan Provider Enumeration System website. You can create an account and establish an NPI number at this website address. Again, as you're walking through the process online with establishing your NPI number, you will be asked to associate your NPI with a particular taxonomy code. And you want to make sure that when you get to that section, you use the drop-down arrow to select the 1835 pharmacist taxonomy code. I won't go through those 5 zeros and an X, but you want to make sure that selection is the one that you pick to link to your NPI number. And this is very important because Medicaid requires that specific NPI number be linked to that specific taxonomy code to ensure that you get reimbursed for the medications that you dispense under the statewide standing orders. And it allows you to bill for the pharmacy service related to hormonal contraceptions. So that is extremely important. Next slide, please. I recognize too that many of you may already have an NPI number. It have been a long time since you established that number. And one of the things that I would encourage you to do is to make sure that you still go visit the website, log in with your user ID and password, and check your profile. One of the things that you want to make sure is that if you haven't looked at your profile in a while, you want to make sure that your information is current and it's up to date. Because again, Medicaid is going to compare the data from the NPPES account to what you're filling in on the Medicaid enrollment application. And if they don't jive, if there's inconsistencies in the information between your NPPS profile and your Medicaid profile, then again, it could delay your application until that issue is resolved. So I give you an example here, just thinking about, someone may have applied for their NPI number a long time ago and they were not married. They used their maiden name when they established it, but now they've gotten married. And as they're filling out their Medicaid enrollment application, perhaps they're using their married name. So again, that's going to be an inconsistency that Medicaid's going to pick up on, and that will cause a delay in your application approval. So make sure everything is jiving between your NPI number and your account and your Medicaid enrollment application. If you don't know your NPI number, you can search in the top field there. I've circled that in yellow. If you forgot your user ID and password, then you can log into the system and go through that process to reestablish your password. Again, let me just mention too, I want to throw out something about the CPPs. Recognize that multiple taxonomy codes can apply to pharmacists based off the type of practice and the type of services or level of care that they provide. So if you're a clinical pharmacist practitioner, you may have an NPI number, and your NPI number may be associated with taxonomy codes that are at higher levels than the level 2 taxonomy code we're asking for this particular hormonal contraception service. So I even encourage, if you're someone that's practicing clinically and you have an NPI number, you want to make sure that in your NPI account that your taxonomy code has included the 1835 taxonomy so that you can also provide those services. There may be clinical pharmacist practitioners out there that freelance or perhaps do some, filling in on the weekends, maybe at an independent pharmacy. And if they're going to be in a situation or an environment where they would be able to prescribe and dispense hormonal contraception, they want to make sure that their NPI number or that 1835 taxonomy code is in their NPI account. Next slide, please. Again, we also talked about, this is something that we didn't talk about, but I think is very important. And you're going to have a hard time reaching the application if you don't have access to NC Tracks, but you must have access to the NC Tracks provider portal. This is Medicaid's management system that allows you to, again, access the provider enrollment form to fill it out. But it's also where you're going to go to electronically bill for those hormonal contraceptive services, and then hopefully other services as we start to see new opportunities arise. If you are not enrolled in NC Tracks, then we've given over there to the left an image for you to look for. There is the link that you can go to enroll, and you just want to click register here. Once you've registered, it will assign you an established NCID number and password that'll come to you in an email. And with the email, you can go back to the providers tab at the NC Tracks homepage, which is provided for you there, the providers in green at nc.gov. Look for the NC Tracks secure portal image, click on that, and then enter your new NCID and your password, and then you will find the image to begin the application process. Next slide, please. Again, just like the MPI account, if you already have an NC Tracks access, then you still need to go into the system, put in your user ID and password, and you want to make sure that your account with NC Tracks also has the taxonomy code that's necessary for you to reimburse for hormonal contraceptive services. The way in which you do this, you don't have to fill out the whole application in itself. There's an abbreviated application that you can access through the Manage Change Request by clicking on that. I can't see that either. I'm sorry, the screen is so small. What I've got circled there, you click on that, and then you can go to the Manage Change Request form. Again, it's an abbreviated application. You can fill out the existing information, but again, when you get down to the taxonomy code section, make sure that you put in the 1835 5 zeros and the X as the taxonomy code. Make sure that's part of your NC Tracks account. Next slide, please. When you get into the enrollment application, there are multiple sections that you're going to need to fill out, especially if you're a new enrollee. And one of the things that I wanted to bring to your attention, and I'm sorry, I'm going to pull this up on a bigger screen so that I can see it. I just have a tiny 14-inch monitor, so it's not as clear. Okay, great. Now I can see it. Once you get into the application process, you're going to run through a series of headings and a series of sections that you're going to need to fill out. What we have learned is that some of the questions in the application process actually lead to hard stops if they are answered incorrectly. And that can prevent the pharmacist from moving forward in the application process. So we wanted to make sure that we highlighted for you tonight what some of those caveats are and where those hard stops are going to occur and what you need to fill in order to, progress successfully through the enrollment application. So again, if you go left to right across this table, you'll see that the headings, I've got up here the application heading, the subheading with the question that you're going to encounter. We've given you the answer that you need to provide. And then if there's any comments or helpful hints, I've tried to put those in there for you. So for instance, you're going to come across the online provider enrollment application. In the subheading right underneath that heading, it's going to have provider enrollment application type. And there you are going to select the radio button that refers to ordering, prescribing, referring providers enrolled with the light application. And that coincides with what Angela was speaking to previously with the OPR light designation. In the individual basic information section, when you get to will your income be reported to an EIN, you want to select no. When you get to the ownership information business type, you want to select self, individual falling under an SSN. The taxonomy classification, there will be 3 places for you to enter information. The provider type, you want to make sure you choose pharmacy services provider. The classification will be pharmacist, and the area of specialization will be none. What that will do is automatically auto-populate that taxonomy classification that you need, that 1835 taxonomy code. In the accreditation section, for the licensing agency, you want to select the Board of Pharmacy. Very important, there is a drop-down selection that says State Board of Pharmacy. You do not want to choose that. You want to choose the Board of Pharmacy drop-down selection. Also, for the licensing type, you want to choose licensed pharmacist and certified immunizer. Again, Medicaid's going to check that licensure with the board, so you want to make sure that's entered correctly. And then under the provider supplemental information for work history, you're going to need to put in your work history over the last 5 years. One of the things that I'll just tell you is that if you have any gaps in your employment record, you want to make in the last 5 years, you want to open up a Word document, give the rationale for what that gap was related to. Maybe you were on maternity leave or something like that, or you took a year off or whatever. But whatever the circumstances are, if there's a gap in your work history, you want to make sure that you open up a Word document, put the rationale for that gap, and then date it and sign it, and it can be an uploaded document at the end of your application. So you're going to need that. Otherwise, you will get a response back with a delay in your application because they're going to need you to upload that information. Now, this is not all. We have a lot more detailed information that we're going to provide for you on the website, but these are the ones that we consider to be the hard stops. So the ones you really need to look out for. What to expect after submission. Some of the things I want to just briefly mention is Angela already said it takes about 2 weeks, 2 to 3 weeks is the application enrollment processing period. Once you do submit your application and it's going out for review, you will receive a response from Medicaid having you or requiring notification that you have to take the North Carolina Medicaid provider online training. That is a state law. It is for everybody. Once you're newly enrolled, you have to take this training. It is about 90 minutes. The one thing I will tell you is that it has a 14-day completion time. So you want to be mindful that it has a deadline for you to complete it. And then, of course, one of the things that I want to throw out there is that either exam failure or a failure to complete the training within the allotted time will result in your application being denied. And then you'll have to retake the whole training over again. You can't just retake the test. So just wanted to, give you that information. It's time sensitive. So you want to hop on these notifications once you receive them. Other application correspondence that you can expect to see in your email would be when your application has been successfully submitted. One, when your training requirements are due. One, when you've successfully completed your training. You'll get another one when you have successful application completion, or when you have incomplete data that you need to submit in order for your application to be approved. And then, of course, your enrollment approval, which would also come with an OPR welcome letter. So one of the take-home points and what I just mentioned with all of this is just make sure that your email that you provide in your application is the email that you feel is the most accurate for you to receive Medicaid-related correspondence, because you will want to make sure these are going to come fairly quickly, and you want to make sure you have the opportunity to review them and act on them if they are time-sensitive. And now I'm going to move into a little bit of information as we shift into this idea of billing a claim for contraceptive services. I thought it would be beneficial to just go ahead and re-preface for you if you're not aware of what the legal requirements are to provide contraceptive care under the North Carolina statewide protocol. Of course, it mimics a couple of things related to the enrollment process. One, you've got to be a licensed pharmacist in North Carolina registered with the board. Two, you've got to be a confirmed immunizer, vaccinator. You have to complete NCAP's hormonal contraceptive training, which I've provided the link for you here. If you haven't done that, that will be a requirement in order to dispense under the protocol. And then you also want to register the completion of your NCAP training with the Board of Pharmacy. Again, you can go back to the licensure gateway. You can check your licensing options, and you want to make sure that contraceptive trained box is checked as well as that vaccinator box. And again, this is the only protocol right now that is available for Medicaid reimbursement, but it will suffice, or it will work both for payment for the product as well as for the medical billing services. So you have to be enrolled in order to get payment for both of those services. And then I think now I'm going to turn it over to Charlene Sampson, who is with North Carolina Medicaid, and she's going to do a little bit more in-depth look at the Medicaid billing opportunity.
Good evening, everyone. I am Charlene, one of the pharmacists on the Medicaid pharmacy team. So the next several slides will provide information about creating the medical claim using the NC Tracks provider web portal. The NC Tracks web portal is for claim submission for Medicaid direct enrollees only. Each of the 5 prepaid health plans have their own provider portal to use for their enrollees. What is the same for Medicaid Direct and the PHPs are the parameters allowed for medical claim billing. This slide displays the billing parameters allowed for the contraception protocol clinical services reimbursement. Of the 4 pharmacy taxonomies allowed, the expectation is most billing will be done with the community retail pharmacy taxonomy. That's the 3336C003X taxonomy. You see only 2 CPT codes are allowed, 99202 and 99212. The reimbursement rate for each is the same as the physician services fee schedule non-facility rate. The diagnosis codes allowed are Z30.011.016.41 and 0.45. The code is selected based on the contraception product selection. Only one modifier applies, that is the FP or the family planning modifier, which is a claim requirement when billing for family planning services. A Medicaid bulletin article with these parameters and much more information was published in late December, and the link to the article is at the bottom of the slide. Next slide, please. Any enrolled Medicaid billing provider can submit a professional claim using the NC Tracks provider web portal. The first step is to log on using your pharmacy provider NCID and password. Select Claims from the menu bar. From the sub-menu, select Create Professional Claim. Just to level set, when we say medical claim, we are referring to a professional claim. The professional claim is the standard format used by healthcare professionals to electronically transmit healthcare claims. You may have noticed numbers on the screen image. The numbers on the image corresponds with the numbered steps to the left of the image. Hopefully, the graphic and step number coordination will help you follow the information shared this evening. Next slide. The first information captured to create the professional claim is the base information and patient information. The base information is the pharmacy billing provider information. When the pharmacy NPI is entered, choice is specific for the NPI, populate the address and taxonomy field dropdown. Ensure the pharmacy taxonomy selected is one of the 4 allowed, and the pharmacy address selected is the location where services are provided. For patient information, enter the recipient's Medicaid ID number to avoid entering a Social Security number and date of birth. Enter the date of service from and to date. These dates should be the same. Select Verify to validate the recipient information. If the recipient is not eligible, the system will return a message, Patient eligibility not found with entity. An upfront eligibility check is strongly recommended before providing services. Recipients enrolled in family planning Medicaid should be a flag. The family planning program has requirements exceeding the scope of protocols. For that reason, family planning Medicaid enrollees are not eligible for contraceptive services provided by the immunizing pharmacist. Additionally, you want to ensure the recipient is enrolled in Medicaid Direct. Next slide. The patient insured screen follows verification. The user will need to enter the patient's complete address. So at this point, I want to share that as much as possible, we are providing images and steps that mirror the NC Tracks portal. Next step, please. After the patient information tab is the claim information entry screen, where general information about the claim is entered. The patient account number is the number created by the pharmacy for the case. It is the number used to identify the claim within the user system. Select 1 for the claim frequency type. The description for 1 is admit through discharge. Admit through discharge means a new day claim. It is an original claim that encompasses the services provided. Assignment of benefit is always yes. The provider accept assignment code is A, assign. Accept assignment code means acceptance of the billing terms and reimbursement. The place of service is O1 pharmacy. Provider signature on file should be yes. And for release of information, informed consent is an appropriate response. Next slide. On the next tab, provider information is collected. For provider type, select non-person entity. When the NPI is entered, a drop-down box for the address and taxonomy is automated. Select the appropriate address and taxonomy code. You will have to enter your pharmacy federal tax ID. For the question, is the rendering provider same as the billing provider? Select yes. Select no for would you like to add a referring provider. Next slide. Use the Other Payer tab to manually enter insurance payers if the beneficiary has other insurance. As always, Medicaid is the payer of last resort, and this applies for the protocol professional claims. Next slide. The service screen begins entry of the service detail for the claim. Select ICD-10 for the ICD version and enter the applicable diagnosis code. Remember, there are 4 available. Next slide. Collection of service line detail continues on the next entry screen. Enter the CPT code. Remember, only 2 are allowed, 99202 and 99212. For quantity, always enter 1, and for the quantity type, select units. The FP modifier is a requirement on the claim. For pointer, select 1. The pointer associates the line item with the diagnosis code. When only one diagnosis code is on the claim, the pointer value is 1. Enter the amount billing for the claim. The amount should be your usual and customary charge. The claim will pay the lesser of the usual and customary and the rate. The place of services is pharmacy 01. For the question, would you like to enter additional information? Select yes. The additional line information section will expand, allowing additional information to be provided for the claim. This is very important because the expanded screen is where the ordering provider information is entered. The ordering provider is the Medicaid enrolled immunizing pharmacist. Next slide. On the expanded screen, select yes for you would like to enter an ordering provider. Enter the immunizing pharmacist's name and NPI. Click Save Service Line, and you must click Save to preserve the information in the claim. If the claim does not have ordering provider information, the claim will deny. Next slide. No attachments are required, so select no. So the professional claim is created. Select Submit. A real-time response will return. Next slide. So this is a new space for pharmacy billing. There may be rejection messages for professional claims that are not familiar to pharmacy staff. If you don't understand the rejection message, call the NC Tracks call center for assistance. Be very clear that you are calling about a professional claim rejection, so you are properly routed for assistance. And I think it goes back to Cheryl.
Thank you, Charlene. So now I'm going to go back and just, we'll kind of wrap things up here before we open it up for a little Q&A. You can advance to the next slide. Just want to talk a little bit about a couple of things. One is that speaking to what about submitting claims for patients that are linked to the Medicaid provider health plans or the tailored plans. I want to throw this out there because what we shared with you tonight up to now has been how to process a medical billing claim for a Medicaid direct member. There are many Medicaid members who are members of the tailored or of a tailored plan or perhaps a Medicaid provider health plan. Those Medicaid provider health plans, AmeriHealth Caritas, Blue Cross Blue Shield, Healthy Blue, Carolina Complete, United Healthcare, and WellCare. What we do have is some preliminary information to give you some guidance as to how you would seek to submit a claim to those payers. We are hoping in the future that we will be able to provide you with more detailed information as we learn. But, again, this is the process. This is a learning curve for everyone. And so what we do have on our website, you can go to, and we do have some links that will take you to each of these different provider health plans so that you can get more information about how to enroll in their provider portals, because each one of them will probably have a provider portal that you will need to gain access to. And within that provider portal will be the ability for you to submit that claim electronically. Again, we don't have it to the depth that we have for the Medicaid Direct tonight, but we are working on getting that. But if you want to take a stab at reading through the information yourself, we certainly have that available for you, and I'll show you where that is. We also know that the North Carolina Medicaid Tailored Plans have not quite launched. That is supposed to be set for July 2024. They will also have their own portals and perhaps billing solutions for submitting claims. And so once we learn what those are going to be, then we're hoping to add those to the website as well. Next slide, please. We'll talk a little bit about documentation. Of course, clear and concise documentation is important for any patient care, but it's very important for receiving payment for services. You have to be able to show what you did in providing that care. At a minimum, you really need to at least cover the reason for the visit. You need to include any pertinent facts or findings or observations in your encounter. You need to have a plan of care. It's important to mention the time spent providing the service. These codes are associated with time-based CPT codes. And so a 99212, or I'm sorry, a 99202 for a new patient visit should be anywhere between 15 and 29 minutes. For a 99212, that's an established patient visit, which would be anywhere from 10 to 19 minutes. Ultimately, whatever your documentation should support your diagnosis and the treatment codes that you are reporting and billing for in the claim. And then thinking about the hormonal contraceptive, the reason for the visit, patients coming into the pharmacy because they're asking for hormonal contraception. As far as relevant vitals or labs, we know that we have to do blood pressure monitoring for those patients. They may not qualify if their blood pressure is too high. And so that would be, a documentation for a relevant lab or a vital. As far as the assessment, clinical impression, think about the fact that we are reviewing the patient's questionnaire to determine their eligibility. If they are deemed eligible, then we're having those conversations with them about counseling on the different types of hormonal contraceptives that are available. Perhaps the ones that they are most interested in, the ones that we can dispense, and then what their impression is. And then, of course, the plan of care, what did we provide? What did we educate the patient on with regards to that medication? What are the necessary referrals if we made any? Do we have to link them to a provider because they don't currently have one? These are all things that are within the scope of the protocol itself, so they would become part of the plan of care. And then what is our follow-up? We know within the statewide protocol, we have to notify the physician that we've dispensed that product. So what is our follow-up with the patient? Maybe we only want to do 3 months to see if they experience any side effects, and then have them back to determine, are they doing well? You know, is this something that we can prescribe for the next 9 months, or, you know, do we need to make adjustments to their therapy? So that's just kind of giving you a little bit of idea. I know, you know, some of you out there have sophisticated systems like Pioneer RX. We know that they have the ability to create care plans for you, or you have the ability to create care plans for yourself. So just thinking about what your documentation needs are going to be, this is very important, because should you be audited by Medicaid for billing, these are going to be some of the things that they'll look at. Next slide, please. And then, of course, this is what I wanted to get to. NCAP has created a North Carolina Medicaid enrollment and billing website for you on our homepage, or off of our homepage. And I've given you the link there. Within it, what you'll see is an overview. On the front page, we will be putting tonight's webinar. It will be recorded, and so we will be putting it on the site tomorrow morning, along with a copy of the slides from tonight. But also notice on the left-hand column, we have these quick links. Within the quick links, we have the statewide protocols. So if you go to that section, it's going to have all of the protocols, not just hormonal contraception. We will have additional information and step-by-step instructions, much more than what we had tonight. We really tried to keep it high level tonight, but we have Medicaid enrollment requirements, step-by-step instructions. We have navigating the enrollment process, which has a lot more detail and step-by-step instructions as you go through each section of the enrollment process. We also have a tab for the billing, Medicaid billing. Within that section, you will find information related to billing for Medicaid Direct, the PHPs, or the provider health plans. The tailored plans we do not have up there yet, but we will put those on as we get closer to their launch. And then, of course, I wanted to give you some idea about next steps. You know, as we continue to foster perhaps advancing scope of practice for pharmacists, billing opportunities, as more and more opportunities become available, pharmacists may want to look to software solutions that help to consolidate billing. If you've got multiple plans out there that you're able to bill to, you know, what better way than maybe to have some kind of vendor that can help you put all of that in the background, where they can help you do that, and based off what you put in your internal dispensing system can help you navigate that. So we intend to have other webinars coming up that show you the different types of software billing solution vendors that are out there to help you do more flexible payment model and medical billing documentation. And then, of course, it's always our hope that, you know, Medicaid has been so gracious with giving us this opportunity to bill for services for hormonal contraception. We're looking forward to the fact that perhaps tobacco cessation is right around the corner, maybe sooner than we think. So as soon as we get more information about that, then we'll be putting that on the website as well. Next slide, please. And then I'm going to leave you with this. I want to talk a little bit about just the importance of early and eager adoption. You know, I can't stress enough that, you know, North Carolina Medicaid is obviously considering payment for additional services within our scope of practice. So we talked about hormonal contraceptive tonight, but we've got, you know, under our state legislation, we've got nicotine replacement, we've got PEP. We've got other opportunities there as well. It's crucial. I can't tell you how crucial it is for our profession to embrace these new opportunities so that we can showcase the enthusiasm that we have for having this opportunity to bill for these services. It's imperative at this point. You know, at present, we're currently and actively working on payment legislation and other scope-related bills. So there's nothing more satisfying in the legislature than our opponents wanting to use, you know, slow adoption, if you will, of a new authority to persuade legislators against supporting our efforts to expand scope. I mean, we've seen it happen with test and treat. You know, they'll argue that, well, we're not quite seeing the, the benefits or the uptick of pharmacists providing birth control. So let's hold off on the test and treat until we see how that goes. I think it's important to recognize that the value that we know we can bring to these services, we have to be able to embrace and just start to work through the process and do these services so that we can, continue to expand scope of practice, continue to generate revenue where we know we're losing revenue in other areas. So, again, I'll leave you with that. I won't belabor it, but I think it's important that we step up to the plate and show how well we can do these services and make a difference in our communities. And so with that, we have several panelists on the line from Medicaid billing, that we have asked to be on the call tonight, so that if there are any questions that we need to bring up about this, then, we will try to cover those questions for you tonight, at least some of them. So Penny, I'm going to turn this back over to you. Is that okay? Would you mind navigating the Q&A?
Yeah, sure, that's fine. Thank you, Cheryl and Charlene and Angela. So I'm going to drop into Q&A first and go to the first question that's in here. It is, has Medicaid thought about how this service can be provided outside the four walls of pharmacy? Example, I go to a community health fair to do the patient assessment and prescribing. Then the patient either comes to my pharmacy to pick up the product or I mail it to her.
Penny, this is Charlene. I'll try to answer that question. We have not thought about service being provided outside of the pharmacy. Certainly, we want to provide coverage in a way that aligns with the activity of our pharmacists. We will give some consideration to that. So I'm not sure exactly, as I look at this question, how it would change the billing parameters that we currently have in place. So I would say more to come in this area.
Another question is, will enrollment in managed care plans, maybe that was an earlier question tonight, will it be addressed? My Medicaid application and training have been completed and approved. Enrollment to the managed care plans are, actually that just moved again because questions are coming in. So enrollment to the managed care plans are challenging. I'm being directed to enroll as a pharmacy, not as a pharmacist provider. So I guess there's concern here that maybe the managed care plans are, maybe there's some confusion over pharmacists trying to get enrolled. It's not the pharmacy that's enrolling, but it's the pharmacist that's enrolling. Does anyone have any comments about maybe the dialogue that maybe has been going on between Medicaid and the managed care plans?
So all enrollment as a provider is done through Medicaid, because Medicaid does provide what we call our provider enrollment file to the plans. So I don't know if the question is about actually enrolling as a provider, and if that's the case, it's the NCTRACS portal is where applications are submitted. Now, I would expect that for each of our health plans that they have a provider portal, same as Medicaid Direct, and we are hoping to provide information, I believe, in talking with Cheryl, that information on how to navigate each PHP's portal to submit professional claims will be provided, but for provider enrollment as an immunizing pharmacist in Medicaid, that's done through NCTRACS and not the plans.
Right. So there's a question about dual eligibles. Is this ability to provide this care and get reimbursed, is it just for straight Medicaid patients, or are the dual eligibles able to be served?
If a dual eligible has their their medication coverage through Medicaid, they should be eligible.
So this is another question about, this is maybe something on a grander scale, maybe for Medicaid to think through, but another question around how does billing function for the office-based pharmacist, right? So it's another question related to the pharmacist, is not in traditional community pharmacy setting, right?
So currently, the billing location that is allowed is O1 Pharmacy. So there's no coverage for the office setting.
This person is saying, I've had a hard time getting my Medicaid provider number because I did not realize there was a problem between a married name and my current name when I graduated. It has put my application in flux for months. I wish I had had heard this talk to know what I should have done to prevent this. I cannot stress it enough for others that may have had name changes over the years.
Is Michelle Sinclair on the call? Michelle, is this something that you can speak to?
Yes, I'm on the call. The question about the name listed on MPES, like you shared in your presentation, needs to match what's on your application. So that does slow down the process. What's unanswered about that question?
I think it was more of a comment that I think this person is really indicating how important what Cheryl had to say is about making sure that your accounts are up to date and that your names are matching, the taxonomies are matching, you know, all of that. So I don't know that there's additional question.
Okay.
So I guess I'm trying to understand this question, but look, something about, will Medicaid cover the $150 visit at pharmacy for something related to a year's worth of birth control, or just 30 days? So again, I think this is about the month supply of the product being provided as part of one of these visits.
Well, I believe the protocol will allow up to 12-month supply, since it has to be done annually, and Medicaid will cover 12-month supply for contraception. I don't know what the $150 refers to.
Yeah, I'm sorry, I was just going to chime in. Yeah, when you think about the statewide protocol does allow for a 12-month supply of birth control. And then at the end of that, you would have to do the assessment over again annually. As far as the $150, that seems a little high for a visit. I'm not sure what pharmacy is charging that, but that is certainly not in line with the usual and customary charge. And if that was your usual and customary charge that you billed, that would not be the amount you would be paid for by Medicaid. But you could, Medicaid would pay you what the fee rate is for that particular CPT code. And we, in the presentation night in the slides, we have the link for you to look up those fee schedules. If you want to download that list, you can look those up to see what they are. I don't know if that answers your question or not, but I think that's what the rate would be.
Yeah, and that's another thing. These slides will be posted
Yes.
On that resource page that Cheryl actually walked everybody through. That's going to be on our website. So you'll be able to get access to these slides, re-listen to the recording, all from that resource page. So another question is, does Medicaid have plans to inform eligible recipients that this service is available at participating pharmacies?
For as much as possible, we get information to our providers. Generally, our communications go to the provider level. I would say for this that we are, relying and partnering with our stakeholders to help ensure that the information, gets out to our beneficiaries and those that would be eligible for the service.
And I could tell you too, I just dovetail on that, Elizabeth, there is a huge effort under UNC's umbrella and a Duke Endowment grant that they received, where there is this whole idea for creating a very robust advertising campaign. You have to recognize, though, the first thing we got to do is get all the pharmacists across the state doing this. I mean, we can't, if we want to blanket public advertising where people know that they can go to pharmacies and get birth control, if we don't have the majority of our pharmacists out there providing the service, then it's going to look bad. But having said that, the thing is that there is a very robust opportunity going on right now to figure out how to best get that communication and awareness publicly announced.
This next question, I think, may have something to do with all of the different numbers and maybe, some of the confusion that pharmacists are going to face when they kind of go in. But it has to do with if you're a pharmacy owner, as a pharmacy owner, would you need to create a new NCID, or would you be added as a provider under the pharmacy, right? So I think
we can ask Michelle to help us with this question.
Yes, and Cheryl, I think that one documentation you were putting that as a ticket item about, it depends on, are they going to, let's see. As the owner, you have the pharmacy, you can also use the same NCID. I apologize for sounding ditzy. It's getting very late. So yes, if you're the owner of a pharmacy and you're already registered with NCTracks with your pharmacy MPI, and you now want to enroll yourself as the pharmacist, you can use that same NCID if it belongs to you.
And Penny, I did see a question about the reimbursement rates. We can share what the rates are according to the fee schedule.
okay. I didn't know if you were able to share that or not.
Yeah,
I know it's on the
sure.
bulletin, or it was
Yeah.
on the bulletin.
Yep. 99202. That's the new patient. I think it's 15 to 29-minute encounter is 5581. And then in 99202, established patient, I believe 10 to 19-minute encounter is 3250.
Is the medication billed through the usual billing pharmacy software or NCTracks? So
the medication is billed for NCTracks, so it will be a pharmacy point of sale claim. So that is how the medication is billed.
yeah.
I'm sorry, you said the medication is billed at the point of sale, not
Yes.
through NCTracks.
It's pharmacy point of sale.
Yeah, okay.
Yeah.
And then how can you update your information with my NCID? Do you have to call NCTracks call center to do this?
This is answered in our slide deck. I don't know if you want to go back to that, but
What is the question again? I'm sorry.
if you currently have, I'm assuming this is if you currently have an NCID number and you have access to NCTracks, to update your information, you're going to go to the, well, the screen will show it, but you're going to log in Here we go. Here we go. You're going to log into NC Tracks. You're going to go to status and management, and it's going to pull up an abbreviated form for you to fill out. And this is where you can make those corrections. So if you are going to a new pharmacy, you can change your pharmacy's physical address. If you need to change other information, this is where you can do that in the manage change or status, whatever that says, manage change request.
Michelle, would you add anything to that response?
No, she's got it. She knows 100% what she's doing.
Okay.
I've been talking to you guys enough.
So there's some questions about being able to be a provider with more than one pharmacy. Do you guys want to talk about that? There's a couple of people that have asked some questions in here that kind of tie into the, are you able to, we had discussed this in preparing for tonight, pharmacists float from pharmacy to pharmacy.
Yeah, that's correct. Pharmacists do float. And so when the enrollment application is done, you will be asked to enter a pharmacy location address. If you're a floater, you can, select or enter the main pharmacy address where you work. However, this will not impact the pharmacy billing for clinical services because there is no relationship between the ordering pharmacy on the claim and the billing pharmacy. So that means that there are no edits in our processing that it's going to stop because there may be a difference in addresses.
This information is also available in the NCAP website under navigating the enrollment process. We specifically address that.
And there's the question about, the pharmacists. So on the medication, could maybe someone at Medicaid speak to the workaround we have in place, but eventually it's going to convert over to the pharmacist would be the prescriber?
Angela, you want to talk about that?
Sure. So for Medicaid to pay for a claim, the prescriber on the claim has to be enrolled in North Carolina Medicaid. Obviously, until this point, we haven't had a pathway for that. And so if we didn't have a workaround, that means all of the prescribing that you're doing off the protocols, our members wouldn't have access to those medications. So right now we have a workaround, and that the pharmacy NPI allows those orders to go through. But we can't have that forever. The prescriber, per federal regulation, has to be an enrolled individual. So that's why it is so very important that the pharmacists get enrolled so that Medicaid is able to pay for the drugs. So it's not just about the clinical service now, it's also about the drug on these claims that are coming off of the state protocols. Did that answer your question?
So the last thing here before we close out is if people have questions, so if they think of other questions, who should they reach out to for answers? Well, I'll chime in and say that here at NCAP, we're trying to work as closely as possible with NC Medicaid to provide resources that will help address many of the questions that will arise. This is a process, and as we kind of are, working with pharmacists as early adopters going through this process, we are learning things. And as we're learning things, we're circling back to the staff at North Carolina Medicaid, and they have been graciously working, to get answers as quickly as possible. It feels like that, this is kind of new, right? For pharmacists in our state, that this whole process of what we're going through. So I'll just say that here at NCAP, we're going to try to provide as much assistance as we can. However, if your application has been denied or you're kind of maybe you're in flux. Those are not the kinds of things that we would be able to assist with, but I don't know if maybe there are other types of questions that maybe Medicaid could be helpful with. And I'll leave it to maybe some of the folks within Medicaid to kind of chime in on this as well.
I agree, Penny. We have certainly, Medicaid has enjoyed a close relationship with NCAP, to create this webinar. I think what maybe would be helpful to the pharmacists if we could create a central point where questions could be submitted. So I don't know if NCAP has a way to collect questions, and then they could filter them, to, the pharmacy team or the appropriate, people to get a response.
Mm-hmm. We can certainly, I think we can certainly explore what that might look like. We'd have to think through what the portal for submitting would be, but I think Cheryl and I are both open to the discussion for how we might be able to handle that. I would
Sure.
say for now, mostly what we need folks doing is taking these steps to get ready to enroll as a provider and also beginning the enrollment process, right? And for that, we know that we have gathered a slew of just information, screenshots, et cetera, that walk you through step by step. So why don't Cheryl and I put our heads together here at NCAP and we can work with Medicaid. Maybe there's some announcement that we could put out to everyone that's in attendance tonight through the webinar. We could share a more concrete answer to what to do if you do have questions. Yeah, and Carlos is asking about a Q&A document. Yes, we are going to be creating a Q&A, like a frequently asked questions kind of document that we're going to include as part of that resource web page information.
So I can't ask Michelle. I don't know if she's still on the call or
Yes,
someone.
I'm still here.
Okay.
I'm still here.
I know in our bulletin article, we provided links, that would be useful in the enrollment process, but is there a telephone number that, someone could call, a pharmacist could call if they needed assistance with enrollment or if they had questions? What would you say regarding that? Because we hope that one of the first actions that our pharmacists, will engage in more heavily after this webinar is enrollment. So would you have any thoughts about if they have questions specific to enrollment,
Yes.
how to get those addressed?
So if you're needing any assistance with your enrollment application, we do have a call center, and there is a number. It's on the bottom of the homepage. Contact us. It's a 1-800 number, 688-6696, and an agent will try to assist you over the phone. And if it needs to be escalated to the enrollment team, there's a process where we have tickets that get created and get escalated. And if you need more hands-on assistance, we have Andrea Horgan on the call. She's one of our provider enrollment rep supervisor, and someone from their team often gets involved with assisting. So call the call center for any questions that you may have with enrollment. And when you start submitting claims, if it's about policy, then we won't be a lot of help to you.
Yeah.
But if it's about submitting claims or enrollment, we can definitely try to assist with that.
Yeah, there is a question about, is it worth going through the enrollment process if you do not have a home pharmacy to work from yet? I think this may depend on your patient population, because there were some, like what if you work with individuals in like a group home long-term care setting? I don't know if that comes into play. Are there other means by which pharmacists that may be seeing patients in one of those other 3 settings that this could come up?
Mm. So are you describing a setting, Penny, that would be outside of the 4 pharmacy
No.
tax?
No, it wasn't one of the taxonomies or setting taxonomies like long-term care. One of them was, I can't remember what the 4 were off the top of my head. This person is
Okay.
asking, is it worth going through this enrollment process if you don't have a home pharmacy to work from yet?
Well,
So
mhm.
maybe maybe they're looking to get employed, or maybe they're not in a traditional community pharmacy setting. So I think it would depend on.
So I guess in the enrollment process, it sounds like they potentially would not have an address to enter for their pharmacy location.
Mhm.
So I guess I'll go then to Andrea or Michelle. What happens in that scenario? You know, they're licensed pharmacists, they're an immunizer, but in this case, they have not, they don't have they're not working currently for a pharmacy, let me say it like that, but intend to.
Well, they have to enter an address, a primary service location.
Mhm.
So I'm not sure they don't have one yet, right? It sounds like.
Right. Mhm.
So why would they begin enrolling if you don't have a home pharmacy that you work for? Because you're gonna have to pay the $100 to enroll.
Mhm.
Is it because you're still completing, employment approval process, then you could use that address. Otherwise, I think you probably need to wait until you have an address.
Yeah.
Primary service location, at least one.
And then there's a question about can a claim be submitted using a medical billing company like Change Health?
Andrea, you want to talk about that?
Hi, Charlene. Yes. To my knowledge, yes, a medical billing company, or what is also known as a clearinghouse or a trading partner, they do have the options to submit claims for providers, as long as, of course, the information that has been given tonight is in the proper fields. There shouldn't be any complications.
Hey, those were all of the questions in the Q&A. There may be some that are tucked away still in the chat box, but we're going to try to capture all questions and create that FAQ document that Carlos was actually mentioning as a suggestion. So I want to extend a warm thank you to everyone from North Carolina Medicaid, DHHS that's on the line tonight with us. Our partnership is invaluable. This is an exciting time for our profession, and really want to thank everyone for tuning in this evening to learn more about the process. And we look forward to continuing to assist pharmacists as we help, get everyone enrolled, as Cheryl was mentioning. The more eagerly we embrace this opportunity, the more it will create new opportunities down the line for us. So, Angela, thank you so much, you and your team. Charlene, we've spent many hours with you getting ready for this evening. Really appreciate both of you ladies, and then everyone from GDIT and enrollment over at Medicaid. Very much appreciate all of your advice and your just your experience in helping us get ready for this new opportunity.
Absolutely. Thank you. And we're monitoring to see the pharmacist enrollment each month go up. And there's a lot of eyes on that metric. So please, you all, if you'll just get in there and try to enroll, it will help us, like Penny said, with future endeavors, which are right around the corner. So please get in there and show some increase in enrollment.
Yeah,
Very
and
important.
you know, there's still right many people hanging on. I will, you know, Angela and I have talked many times, you know, going back since I've been here in my role and she's been in her role. This is truly an exciting time, but she's absolutely right. There are more eyes watching this than just pharmacists, you know, so we really encourage everyone to, you know, like take the bull by the horns, so to speak, and actually go through this process and start submitting claims. And I think in the end, it's going to help the entire profession. Obviously, it helps patients. You know, that's what we're here for. And that's what we put first and foremost. But from the profession standpoint, we don't always think about like the steps that we take that better position pharmacy so that we can do more for patients. And so, yeah, this is great time, and I'm truly excited to see we've got some wonderful legislation teed up to run in the short session. I'm hoping we can continue to make great strides and gains as we march down this path. And I want to acknowledge, I have done so in writing several times now, but I want to acknowledge it online tonight, that Medicaid is the first major payer to come to the table to really enroll pharmacists as providers to be able to begin providing this type of care. So thank you for what you're doing over there, Angela, for helping to usher in a new era for pharmacy.
Absolutely. I'm so honored to be here at just this very time, right? I mean, like we've talked about before, you know, this is what we talked about in pharmacy school, right? And now
Yes.
some 28 years later, for me, here we are doing it. So exciting. Let's be successful.
All right, that concludes our program for this evening.